developed Sputnik V vaccine has over 91% efficacy against COVID-19. The Food and Drug Administration says it's still assessing 2 COVID-19 vaccines for possible emergency use in the country. The Chinese and Russian pharmaceutical firms are expected to get their EUAs this month, several weeks after the approval of Pfizer's application.
Ang bakuna po ay maaari lamang ma-access through the government vaccination program. Kung sakali man na ang gobyerno ay mag-designate ng mga LGU o kaya mga private company to be part of the vaccination program, kasusunod din po yon sa alituntunin ng Department of Health.
Russia is ready to deliver the Sputnik vaccines to the Philippines, but while the vaccination program is ready to roll, the government acknowledges an uphill struggle to convince Filipinos to be vaccinated. Health professionals are working to remove the hurdles, but the other challenge is how will the public health system conduct the vaccinations? We discuss all of that in this episode of The Chiefs. Welcome to this special edition of The Chiefs. With us on the program is Lucy Cruz Valdez of News 5, joining us from Quezon City, and Ami Pamintuan, Editor-in-Chief of the Philippine Star, joining us from the port area in Manila.
Ed is not here today.
Ed is not here today, and we're going straight to our guest right now. We have a very special guest, and we don't want to waste his time. We have with us Russian Direct Investment Fund Chief Executive Officer Kirill Dmitriev. The fund is the one financing the development of Sputnik V. That's the coronavirus vaccine found in a recent study to be 91.6% effective against symptomatic COVID-19. Good evening, Mr. Dmitriev.
Good evening. Thanks for having me.
Yes, and welcome. So this is obviously big news. This is one news that's really gotten headlines all over the world in the past week. We already know the efficacy, and this is being validated by scientific journals worldwide. But tell us, what is different about how this vaccine works?
Well, I think what's very unique about Sputnik is that from day one, we thought about being really the vaccine for mankind. So not only is it very effective, not only is it very safe, because it's based on a common flu virus, and really technology has been proven over decades. But it also can be stored in a refrigerator, doesn't need minus 70 degrees centigrade as some other vaccines, and also costs 1/2 to 1/3 of some of the US vaccines. So the unique feature about Sputnik is that on all parameters, efficacy, safety, storage, and price, it really, in a combination, we believe is one of the best vaccines in the world. And we are very excited to be partner with Philippines and be able to deliver to Philippines at some point. And already, as you know, 22 countries approved Sputnik V for use in their countries.
Okay, now when you say a refrigerator, so obviously this does not involve minus 70 degree centigrade cold chain facilities. But when you say refrigerator, do you literally mean my freezer at home actually has the capacity to store this?
Yes, so it can be stored at +2, +8. And then you also asked about another unique feature. We are the only vaccine in the world that uses 2 different components for 2 different shots. And what is unique about that is that we generate, because of this approach, we believe higher immunity that lasts longer. And it also is very good in fighting mutations. So that is a second unique feature of Sputnik V. But then again, we believe that the Philippines is doing everything right in having a portfolio of different vaccines. Philippines should not rely just on 1 or 2 vaccines. It's very important that you have a portfolio of 3 or 4 different vaccines to really work with several manufacturers.
Okay, you mentioned the word mutation, and right now one of the concerns here is, of course, the UK variant. Let me ask you whether Sputnik V actually addresses this variant as well, and many other variants that might get into the country.
Yes, so our scientists did analysis of this, and they believe that Sputnik V is as effective with this mutation as with the original virus. And our scientists constantly test for mutations. What is a unique feature of Sputnik V is that on average, we manufacture 1.5 times higher level of antibodies than for a very sick person, whereas many other vaccines just do the average level of a sick person. So our vaccine generates stronger response. And the stronger response tends to work better with mutations, but we are also doing several studies now with new mutations and definitely believe that Sputnik is well positioned to fight with new mutations that are coming in and will be happening as well.
Okay, many Filipinos are confused about whether Gamaleya and Sputnik V are one. Can you just clarify to us exactly what the relationship is between Gamaleya and Sputnik V? I understand Gamaleya is the developer, right? And
Yes.
then you represent RF, Russian Investment Fund. What exactly is the relationship among all you three?
Sure. So Gamaleya is a great research institute, and vaccine development goes back 250 years in Russia. And Russia, Soviet Union has historically been very, very strong in vaccines. Gamaleya is one of the oldest scientific institutes in Russia. And my fund, Sovereign Wealth Fund of Russia, has been one of the investors in the vaccine to help it develop and help it really grow outside of Russia. So we basically work on production facilities outside of Russia. We ensure that we have agreements with other countries outside of Russia. So we are basically partners with Gamaleya to build and develop Sputnik V vaccine, which, as you mentioned, is one of the 3 vaccines in the world. That is one of the most effective vaccines. It's one of the 3 vaccines in the world with efficacy more than 90%.
Mr. Dmitriev, of course, the problem is the supply. There's a shortage of, I think, all types of vaccines at this point. What's the capacity of Gamaleya to produce vaccines? And how many countries is the Sputnik V going to be initially rolled out? Would you have any?
So we believe that this year we can supply vaccine to 700 million people around the world. So we are not capable as of now to provide it to billions of people. And we have facilities inside of Russia. We have also facilities in China, Brazil, Korea, India, and several other countries that are manufacturing for us. So as you see, this year will be a year of vaccine shortage in all of the countries. Europe said that only by September they will vaccinate many people. So this is why we'll be one of the providers, and we are happy to start supplying to Philippines as soon as we get an approval here. But of course, we will have to supply over 6-7 months any volumes that Philippines need. So over 6-7 months, we can supply any volumes that Philippines need from us, but basically it's going to be gradual supply over the next couple of months.
Yeah, Mr. Dmitriev, the headline here, of course, is that Russia is ready. You brought up the point about the Philippines. Is the Philippines ready? Where exactly does the Sputnik V stand when it comes to herding the bureaucratic and other protocols involved in actually getting that vaccine here?
Sure. Well, we submitted the documents already to your health ministry. And by the way, you have a very professional team. And as I mentioned, I think they're doing a very professional job with other vaccines, with Sputnik, to evaluate everything. So all we can say is that Sputnik has already been approved by 22 nations. And by the end of the week, we expect approval in 25 nations. And in Russia already, millions of people have been vaccinated, in Argentina and other places. So we hope that approval in Philippines comes. We have submitted all of the necessary documents for this. And, we are ready to start supplying whenever this approval comes in Philippines. But once again, we have no doubt in the professionalism of your regulator, and they're doing an excellent job with us and with other vaccines as well.
Well, we understand that some documents are still missing from your application for emergency use authorization. Is that correct? Well, what's holding up the approval? Would you know?
So we don't believe any documents are missing, because based on the documents we've given, 22 other nations already approved, including today Pakistan approved, and we have 22 nations that have approved, and the same set of documents was sent to Philippines. So we don't believe that anything is missing. Philippines has exactly the same documents as all of the other countries have.
Okay, can you expound more on the gradual rollout of the Sputnik V vaccines here in the Philippines. So when you say 6 months, what would be the earliest possible delivery time? And because that's basically going to be the baseline for the 6 month rollout that you're talking about, and how many millions are we talking about if indeed it comes to a million?
Sure. Well, I don't want to go into too hypothetical because we don't have approval yet. But I will say that upon the approval, within the next 2 weeks, we will be able to supply, some doses of the vaccine so you can start vaccinations. And that, again, needs to be approved by your government, how much. And then we will basically be able to supply, next month, maybe about 10% of your total need in vaccines from us. And then the following months, about 20% of your total needs. And then the following months, 30% of your total need, so altogether around 50% of your total need in the next 3 months, and then the rest over the other 3 months. So we have, it's very important for us to know though when Philippines registers, because right now, of course, we have huge demand from 22 nations that already are using our vaccine. And just this week, already 12 nations are using Sputnik. For 10 of those nations, it's the first vaccine they receive. So, of course, in order to plan, we need to understand when the approval comes, but we will work very closely with your government to make sure that Philippines is a great priority, of course.
Okay, Mr.
How do you
Dmitriev.
assuage fears how do you assuage fears of Filipinos who, in a survey, seem to have indicated that they're more confident with vaccines from the U.S. and Europe, but they're very hesitant about vaccines from China and Russia? What would you say to them?
Well, I think, first of all, it's important to look at technology. And our vaccine is based on human adenoviral virus that is basically a common flu virus. Whereas US vaccines are based on a very new technology called mRNA, which may be great, but there have been no long-term studies of its safety and efficacy. And if people really trust the US, they will like this fact that human adenoviral vaccines, every US soldier received from 1971. So it is so safe that every soldier gets a US vaccine, human adenovirus based from 1971, and that's the basis of our technology. So there is no question whatsoever that the human adenoviral technology that we use is one of the safest technologies, definitely studied for decades over chimpanzee adenovirus or mRNA, which are newer technologies. But I think the question should be not choose this or choose this, choose this. The question is, Philippines deserves to have a portfolio of different vaccines. Sputnik should be one of those vaccines because it's one of the best vaccines. And then people can decide individually, but I think it's important that people have a choice. And I'm sure that many people would choose human adenoviral vaccine versus less proven and newer technologies.
Okay. Mr. Dmitriev, we know you don't have a lot of time. We'd like to thank you for being gracious for the time you've spent with us. Thank you very much.
Thank you so much. Really appreciate this.
Thank you, Mr.
Thank you,
Dmitriev.
Mr. Dmitriev.
That was Mr. Kirill Dmitriev, Russian Direct Investment Fund CEO. Please stay with us. The Chiefs will be right back.
has identified several points for improvement after today's nationwide vaccine transport simulation exercise.
Vaccine czar Carlito Galvez Jr. and other officials conducted a simulation for the expected arrival of vaccines from the COVAX facility later this month.
The country's top officials insist that the anticipated COVID-19 vaccines can deal with the different variants of the coronavirus.
Yung bakuna na dadating sa akin is as equally good in terms of efficacy and potency against the new variant.
Welcome back, the Chiefs here on One News. We are now in the final stage of our conversation. Now joining us is health social scientist Professor Nina Castillo-Carandang. Good evening, Professor.
Magandang gabi po.
Professor. Magandang gabi rin.
Evening.
But we want to emphasize health social scientists because, you know, we've been talking about the vaccine, we've been talking about the virus, and the reality is parang ang isang pinakamalaking problema pa natin is how do we even communicate, how do we even convince our people to go for this vaccine? Are there any new insights that will give us, you know, a better plan of attack on how to encourage our people to have more confidence about vaccines regardless of kung saan manggagaling yung mga bakuna na yan?
Thank you very much for that question. No? I'm the only social scientist in the UP College of Medicine. And that, for me, is an acknowledgement that beyond the human body and health concerns, there are social behavioral concerns. So there's a lot that we can do, and one is through programs like yours, where we share information, and when you invite experts, then the people actually hear from the right sources of news and information. So I think that starts with one. We have a big disinformation, misinformation, underinformation, all from the wrong sources, mostly.
So what's the, I was looking at some recent numbers. I don't know if that necessarily came from you, but as part of the research material we were looking through. But one thing that caught my eye was this runs across all demographics, even among college graduates. From what I saw, there is huge hesitation. So it's not just a matter of vulnerability to the wrong information. It seems that even the level of education doesn't seem to make a difference here.
Can I show you some data, which I have? I
Yes,
have some
please.
slides,
Yes,
which I
please.
can share with you.
Apa.
Okay. Wait.
Ma'am,
kasi-
can you give us a brief background on this data? Where did it come from? Yes.
I have it here. So do you see it na po?
Yes.
Apa.
Okay. So we have a compilation of data, which I did with the Department of Health. And there's global also data from the CAP, the Knowledge Attitudes Practice COVID Dashboard, which is hosted by Johns Hopkins University, also with the Facebook for Good and MIT. So the January 4 survey shows that only 52.6% of those who joined the survey said that they were highly likely to be vaccinated. The SWS survey showed 66. The IDI UNICEF survey showed 52. Pulse Asia showed 32. Okta showed 25. Then DOH, they have different sorts of data, and it shows you that for non-healthcare frontliners, it's 56.5. For senior citizens, it's 58.5. Quezon City also ran a huge survey, 56.6. So as you can see here, the general population, the willingness to be vaccinated runs from 25 to 66%. Let me proceed to the next slide. So here you have all of the different sources of data. As you can see here, there are also people who are not sure that they want to be vaccinated. So that, for me, is a group where we could try to actually convince to be vaccinated. And for healthcare workers too, a lot of them also actually weren't 100% sure that they wanted to be vaccinated. So
Even
let me
healthcare
show you
workers.
just here, for example, healthcare frontliners is DOH data 63, and the highest was from the Philippine Society for Microbiology and Infectious Disease. I designed the survey for them, which they did among 93 infectious disease experts.
Excuse me.
Then we did town halls with different groups, with the Philippine Medical Association, Philippine Nurses Association, Philippine Pharmacists Association, and midwives. And you can see here that after 3 hours or more of talking with different groups, you actually have a change. Those who were highly likely increased across all town halls. So what do I have to conclude from here? That more information is needed even for those who are supposed to be more familiar with health concerns such as vaccines. I also spoke in a town hall with LGUs, and there were over 1,000 people from LGUs. So governors, mayors, councilors, their health officers in different LGUs. And after about 2-3 sessions, they were convinced that 82% said yes, they were highly likely. Not likely was 3%, and not sure was 16%.
Okay.
I also asked pharmacists and midwives if they were willing to be vaccinators. Under the Philippine pharmacy law, pharmacists are now legally authorized to administer vaccines. And as you can see here, there's a great willingness among the pharmacists and also the midwives to be vaccinators themselves. So what's our behavioral goal? We want to achieve high and equitable uptake of COVID-19 by the general population. And achieving this goal will depend on the behaviors of other actors in the systems. Those who are offering the vaccination, those who are planning how and where to offer the vaccination, those who are tasked with maximizing uptake using strategies such as persuasion, the use of trusted endorsers or validators. To achieve high and equitable vaccine uptake, we have to use existing scientific knowledge, and we acquire new information, learn in real time. We find out what works, doesn't work. We engage with populations. We listen to and respond to their perspectives, concerns, and expectations. These efforts can play a role in building the trust of the community and health systems and informing the design and delivery of policies and services.
Yes, ma'am. So the bottom line is, no, we need to build up trust. A lot of those seem really important, common sense. We've done a lot of public health campaigns in the past. Hopefully, we've learned from that. But when we look at, we always bring this up. We ask our government officials, are you willing to do this in public? No. We asked a mayor point blank, are you willing to be the first to receive Sinovac? Hindi naman talaga. And then I don't know if I looked at kanina sa slides, I was looking at it, in terms of finding role models, ang konti rin ang pinaniniwalaan nila. They don't believe journalists like us, mababa ang trust sa politicians. So, saan tayo aangkla? To whom or to what do we anchor our campaigns?
Interestingly, the data from the CAP COVID dashboard shows the information sources of Filipinos, and about 70% say they trust scientists, doctors, and health experts. And not surprisingly, only 14% trusted politicians. So the politicians rank the lowest in terms of trust in information sources. So what's the bottom line here? We should hear less from the politicians and more from the scientists.
All right. Yeah, okay. Earlier, you were saying that you saw a rise in numbers in terms of those who will want to be vaccinated after hearing information from you. So my question is,
not only me, all of the health experts, vaccinologists, immunologists,
yes, okay.
Department of Health. So it was a multi-sectoral experts panel which shared the information.
Yes. I'm just curious, what were the basic knowledge gaps that you needed to fill in order to convince a considerable number of them to actually change their minds?
When we analyze our data for healthcare workers and general population, those who were likely to be vaccinated said that they were concerned about protecting, preventing, immunizing themselves against COVID-19 to keep themselves safe and their families safe. Those who were not likely to be vaccinated among the healthcare workers, there was concern that this vaccine was not thoroughly studied, whatever kind of vaccine it was. Among the general population, there were concerns about safety of the vaccine. Those who were not sure, for the healthcare workers, they also cited safety concerns. For the general population, it was not enough information. So as you can see here, whether you are a healthcare worker or a person from the general population, like most of us are, it's really safety, which is primary, and the lack of information. But on the other hand, there was this general perception, I need to protect myself, I need to protect my family. So I actually launched a slogan, which I've asked the DOH to also think about. And if all the processes are done correctly, dapat tama. Tama ang proseso, tama ang ng pagpili, tama ang presyo, tama ang bakunang napili. Love kita, halina at magpabakuna. So we piggyback on the people's needs to protect ourselves and our loved ones. So if I'm going to be vaccinated, I'm not only protecting myself, but I'm also protecting all the other people around me. Kasi very familial ang ating relations, very interpersonal. So hindi lang para sa akin ang magiging benepisyo ng bakuna, kundi para sa ating lahat.
Doctor, was there also discussion in your consultations about the China factor in the vaccine hesitancy? Because there were also some studies conducted by local governments, and they're saying yung mga ayaw daw magpa-vaccinate, ang unang sinasite nila is they don't want the source, not the brand, the source of the vaccine. And I noticed umaakyat yung nababawasan yung vaccine hesitancy as reports come in na ang papasok pala sa atin is Pfizer na and with the Western vaccines actually. In fact, ngayon, wala nang pinag-uusapan ng Sinovac masyado eh. Ang iniintay na natin ngayon is the Pfizer, the Moderna, and the AstraZeneca. And maybe the Russian, which we talked to the Russians earlier. So was there any discussion during your consultations about this factor as well? And do you think we should also dispel fears about the Sinovac vaccine? Kasi siguro baka kulang din lang naman sa information nyo.
Well, the surveys actually show that there's a lot of discussion about the brand or the manufacturer. So there's that also trust factor. And let me be honest, I don't think the vaccination of PSG and the POGO workers, if they're indeed true, with a drug which is not officially registered in FDA, helped the situation at all. And of course, there's no official admission of what vaccine was used, but your guess is as good as mine as to which one it was. So I think the fact that there was use of an unregistered vaccine among people who are in power also tips the balance a lot, because there should be equity in also the vaccine deployment. There should also be trust in vaccine deployment.
You think this hesitancy toward vaccines made in China can still be overcome? Because China is saying, well, our vaccines work. I mean, is it just a lack of information or wrong information? Can it still be overcome? Because I think we will still be ordering some Chinese vaccines kapag kinulang tayo.
We need to expand our portfolio of vaccines because of the global vaccine shortage. So that means that we need to try and purchase and arrange the supplies from many different manufacturers across different countries.
Including China.
Submit all of their scientific data for vetting by our scientific panels. It's really hard to say how good or how bad a vaccine from one country or another manufacturer is. I'm not even pointing directly to a Chinese-made vaccine.
Yeah.
So we have a very robust process for vetting. We have a vaccine expert panel. The FDA also has its own vaccine experts who examine the application, such as the gentleman who said earlier. He also said that we do have a robust process. Then it goes through another layer. I'm a member of the National Immunization Technical Advisory Group for COVID-19. And we are a recommendatory body of experts. I'm the only social scientist. Everybody's a physician. And we are recommendatory to the vaccine cluster headed by Secretary Galvez. So there is a robust system of different panels of experts appraising the evidence, looking at side effects, looking at benefits, examining the various claims of the different manufacturers.
Ay, Doktora,
Is price
nabanggit nyo
even
kanina
up?
yung, we've been talking about the hesitation. I just want to bring in again an insight from Navotas. So si Navotas Mayor Toby Chanco said, kinutkot pa nila yung mga tao na ayaw magpabakuna. And specifically, dun sa mga ayaw magpabakuna, they asked bakit. And their insight, which he feels is key, was that actually hindi pala nila sinasabing ayaw nila. Ang sinasabi nila, ayaw nilang mauna. Ang sinasabi nila, mauna ka. Ilalike ko, tapos nandyan ako sa likod mo. No? Now, I want to link this with another thing you pointed out, that we are a very family-centered society. We keep asking, sino ba, which sectors will people listen to? But what about within the family? Are we therefore saying that as long as mayroong mauna sa pamilya, whether it's tatay, nanay, ate, kuya, that can make a difference within families?
I'll use my own family as an example, and also my in-laws. They will probably not be very happy that I use an example again. My nuclear family, we all have vaccinations. My late parents were both scientists, so very science-based ang nuclear family ko. My late nanay was a national scientist. No? Yung in-laws ko, dudang-duda yan. So, over the years, experiential. So, kailangang flu vaccine ang pinag-uusapan po natin. When we had it, sabi ko, subukan nyo po, tingnan nyo. Eh, di na kumbinse. Tapos, okay pala to, maganda pala epekto. So, after several years, sila na po ang nagpapahanap usually sa akin ng bakuna. Means, nasa na yung pambakuna namin ng flu every year. So, sa akin po, experiential yung pagbabakuna. And my plea is to make the vaccination experience a pleasant one. And sino ba usually matapang magpabakuna? Kayo po, Miss Lucci, sa bahay niyo po, sino hong matapang magpabakuna?
Wala po.
Baka kaya kailangan experiential din, no? Subukan niyo muna sa flu vaccine. Kayo, Ma'am Ami, sino pong matapang sa inyo magpabakuna?
Ako. I'm not afraid of shots.
And then when you have it, sumusunod ba po yung iba niyong kasama sa bahay?
Last vaccination ko, bata pa ako. So,
Okay.
hindi ako nagpapa-flu shot.
Okay.
Ako
Ano po,
naman,
Mr.
ako
Roby,
student
sa
na.
inyo? Sino sa inyo, Mr. Roby? Babalik ko sa iyo yung tanong mo.
Well, ako, matapang ako. But then, my wife is a Flavier. So, kailangan by example, mauna rin siya. No, but she's a public health, that's been her career as well. So, she sets the example for all of us as well.
So, sa marami pong pamilya, ang mga babae po ang matapang. Ang mga lalaki po atapang-atakot.
We agree.
We know, for example, that who brings the babies for vaccination? Is it the tatay? Is it the nanay?
Of course.
Usually, it's the lolas and the nanays, di ba?
Yes.
Pero may aaminin po ako sa'yo, sinabi ko to nung unang town hall. Kami po ng sister ko, notorious po kami sa school namin noon. I live in Los Baños. Hinihimatay kami dalawa ng sister ko pag magbabakuna na ng cholera shots nung elementary kami. Automatic yon, notorious kami. Eh, ang lalaki po ng hirindilla nung araw.
Don't look at it.
And then you see the nurses in brown uniforms boiling the needles and the syringes. It was
Hindi pa
traumatic.
disposable, no?
Ngayon po, maliliit na, mas aseptic po, hindi na ho pinakukuluan. Nung kinuwento ko po yan in public, tawa sila. Sabi ko, I'm sure some of you can also identify with that fear factor. But now that I'm much older, I'm no longer afraid because I know that vaccines are good for us. They have
Professor-
been studied and they have gone through a lot of testing.
Well, ang sinasabi po nila, yung recent experience, since we're talking about experiential basis for agreeing to be vaccinated, the most recent, of course, was Dengvaxia, and that's in the national memory, if I may, no? How much of this is getting in the way of convincing Filipinos now to be vaccinated against COVID?
Even before Dengvaxia happened, we already had lower immunization coverage, unfortunately. Unlike in the time of Secretary Flavier, Roby, 90% of kids were vaccinated. I remember accompanying him on one polio campaign, and the kids were all calling him, si Patak, si Patak. People were so excited to have themselves immunized. And then I don't know what happened along the way many years later. So even before Dengvaxia, we had a falling immunization rate.
Yeah, but Doctora,
So there were many reasons for hesitancy even before Dengvaxia.
But Doctora, let me say something and add something that to make my father-in-law happy and to get his approval even from heaven. But going back to those days, you said kasi kanina, we also have to make it fun. We don't have, but
Yes.
we look back to Oplan Alis Disease, to the Patak centers. People were going to Jollibee's, to McDonald's, to fast food restaurants. The private sector joined in the fun, not just the mission. Maybe something like that will also help. And I'm sure there are a lot in the private sector already asking, what can we do? What can the private sector do to make this not just urgent for all of us, but still fun?
For the private sector, they have a very important role, just like the LGUs, because they deliver services directly to the people. And government has also limited reach, so they can offer to partner. But I have a plea to the private sector and the LGUs. Please follow the guidelines set by the national government for vaccine deployment. Hindi po ito ang panahon para sa kanya-kanyang diskarte. My plea is for solidarity and for equity in vaccine deployment. So kung sino man po ang may kanya-kanyang diskarte po, wag po ngayon ang panahon para doon. In the LGU forum, I didn't put it in my slides during that talk, but I made a plea. Pakiusap ko po sa mga mayor at sa lahat ng governors and all the local officials there. Ang bakuna po ay hindi equivalent sa boto. Wag po nating gamitin. Wag nating i-weaponize yung bakuna para po sa boto. Yun po ang pakiusap ko. Wala pong naka-imik nung nagsalita po ako ng ganon.
Doctor, you think it will be best if health, siguro doctors, physicians, and nurses will be vaccinated in public? Baka si Dr. Taya gusto uling sumayaw, di ba? Para masaya, parang si Mr. Patak, di ba? Will that help? Kasi nandun yung trust level sa
Yes.
health workers natin, mataas ang trust level, especially in this pandemic. Will that help?
The healthcare workers are our number one priority for vaccination. So definitely that will help. But I think people are also expecting high-ranking government officials, whether they are in the health sector or not. And of course, we have to weigh that carefully. They might also receive backlash. Hindi ka naman healthcare workers, Hindi ka naman priority one. Bakit ikaw nauna? Pero nakaabang naman lahat ng tao. Boss, una ka na muna. Mayor, governor, cabinet secretary, una ka na muna. Tingnan natin. So, meron ho yung pros and cons. I know that we're looking for people that we can trust, who will probably influence, but they might also have that backlash. Bakit siya nauna? Di naman siya kasama dun sa priority na sinet ng gobyerno ng healthcare workers first. So, pag-aralan po natin na mabuti yun.
Okay,
Are
Pero
you-
naman, wag na natin ipagkait, kunyari, si Secretary Duque magpabakuna, halimbawa, no? And other high-ranking people from the Department of Health or even from the government agencies. Tinanong po ako kanina ng mga kasama ko or the other day, pwede ka magpabakuna? Tumawa po ako. Sabi ko, ay, makikita yung aking malaking braso, sabi ko, sa TV. So sabi ko, pero okay lang din kung kinakailangan. Although I'm not a priority because I'm not a healthcare worker.
Ang gusto lang naman na role model para sa Sinovac eh. Yun ang hinahanap ng mga tao,
Oo.
role model sa national leaders. Sa Pfizer, ang pinoproblema baka nga people will jump the vaccination queue. Kapag Sinovac, lahat ayaw magpakaano at naghahanap sila ng mauna ka. Doon yung mauna ka actually, doon sa China-made vaccines.
Sa tingin niyo po, ma'am, sino po ang magbo-volunteer sa ating mga opisyales?
Sa Pfizer, I think everybody will want to volunteer. Yan nga problema. Baka maubos yung 117,000 shots sa government officials pa lang.
Babantayan po namin yon.
Ma'am, Doktora, I'm just curious about, nung nag-umpisa, as you said, puro politiko naririnig natin. And thankfully, government did hear the message and the importance of, no, let's hear from the scientists. And we swung that way. But now that we're getting ready to vaccinate, I think you have you yourself are your own point, that you said, we need social scientists on the panel as well, because that brings us a different kind of insight on how to address behavioral issues. I mean, talk to that. I mean, do we have enough of the social scientist perspective as well for behavioral change?
Thank you for that question and making a pitch for my profession. We lack enough social scientists at the dinner table. There are many adequately trained and very competent social scientists, but we haven't been invited to the dinner table. I'm just very weird. I always describe that of myself because I'm the only social scientist in the UP College of Medicine. And it took 115 years for that to happen until now. No? So, weird lang po ako. Marami po tayong competent social scientists, but we haven't been invited to the dinner table.
But I just want you to explain why. I mean, no, not bakit kulang, but why do we need social scientists? We have great physicians, we have world-class scientists. Anong ambag ng social scientist when it comes to our public health programs?
I'm often asked that. So what's a social scientist, a sociologist doing in the College of Medicine? Because sabi ko, beyond physical health, there is well-being. A lot of my work is about kagalingan and a search for well-being. So beyond our aches and pains, physical, we have our social, mental, psychological well-being, emotional well-being, and a lot of which has suffered in the lockdowns and in the pandemic. So anong ambag namin? We bring a behavioral insight and a more holistic insight beyond the medicines. Nandyan ang bakuna, pero kung ayaw ng tao magpabakuna, paano? Sinong tatawagin natin?
A few weeks back, I think it was just a week ago actually, the UPPGH organized a webinar entitled Who Should Not Be Vaccinated? So in effect, no, a question was posed as to sino ba ang dapat talagang hindi magpabakuna. And so, yan ang gusto ngayon malaman ng mga tao. Meron nga bang mga tao hindi dapat magpabakuna? At sino-sino yon? Are we even telling people whether they should not be vaccinated? Kasi we've just been focusing on who should be vaccinated or why you should be vaccinated. What's the info gap there?
Well, the speakers in the said webinar are all my colleagues. I work closely with them. And they're some of the best physicians in this country also, and researchers too, and scientists. Definitely, if you have allergy to the components of the vaccine, then you are probably not a good candidate. But the bottom line is, you also need, for those with special health conditions, it is in your best interest if you do have a consultation with your primary provider for a risk-benefit assessment. I can share with you later the links to that presentation, so you can also share it in your website because it's a very useful information shared by Dr. Regina Berba, who's the head of our infection control unit in UPPGH. Maganda po yung kanyang set of slides, meron pa siyang FAQs dun sa likod.
Yes, because in the story conference of news, no, when we brought that up na parang yung mga may allergies daw hindi raw dapat magpabakuna, and everybody said, sino bang walang allergy? So, that also raises a very valid question, no? Halos lahat naman meron.
Allergy to specific components in the vaccine itself. Yun po yung...
Okay. So it's not allergies in general.
Oo. Ako po may hika.
Yeah.
Ako po ay may allergic rhinitis. So napakataas po na aking tendency. But because I have those comorbids, I would have that discussion when the time comes with my primary physician, if it's good for me or not. But in general, they're all saying, ay, kailangan pabakuna ka. Fine.
Pero
Kailangan po, may informed discussion din po kayo with your primary physician po.
But this is the thing, no? What if we're going to roll it out and karamihan ng mga Pilipino, wala namang mga health consultants or or
Totoo po yun.
doctors or family doctors, paano nila malalaman na hindi pala sila kandidato for this vaccine? I mean, I think a lot of the fear is being generated by that, no? Paano kung meron akong reaction na hindi ko man lang
Meron pong
alam?
gagawing health screening sa vaccination site. Meron po doon health checklist. So, tatanungin po kayo doon, meron ka ba nito, naramdaman mo ba ito? So, doon po, maa-assess ka. Kung sa tingin po na nag-assess po sa inyo, kailangan nyo pa ng further assessment, there's the next level of checking. So, miski excited ka magpabakuna, pumunta ka doon sa vaccination center. Miss Lucia, I'm expecting you there in the vaccination center.
Delikado yan.
I'm immunocompromised.
Delikado yan.
Immunocompromised
You
yan.
will be assessed
Oo.
further. And then, if they aren't sure, then they will refer you. So we do have a checklist. We are still finalizing that, care of my clinical colleagues. And then there's an assessment procedure. There's also going to be a procedure for monitoring adverse events 1 year until after the vaccination.
Oh, wow.
Doctor, halimbawa ako, I have severe allergies eh. Pero sabi dun from the experience sa US, maghanda lang daw ng antihistamine if you have allergic reactions. You take your shot and then you take the antihistamine. Is that a safe response to this?
I would hesitate to respond to your query, Ms. Ami, because I'm not a physician. But I will just share with you that after the vaccination, everybody will be asked to stay in the vaccination site for 30 minutes to up to 1 hour for them to be observed if there is any adverse reaction. So meron na din pong safeguards na ganon. So pagka screening po, informed consent, tapos po babakunahan po kayo, tapos po mag-aantay ng 30 minutes to 1 hour, tapos po babantayan pa rin po kayo up to a year. Bakit po up to a year? Because these vaccines are under emergency use authorization. Pinag-aaralan pa po kung gaano kabisa ang mga bakunang ito. So yun po ang magiging proseso.
Doktora, what about, we've been talking about yung ambag ng iba-ibang sektor. What about us sa media? What are we doing wrong? What are we not doing well enough? What can we improve on in the communication needs for vaccination?
Well, one is to always hear it from the sources. So I was invited by your crew last week, but it was just so photo finish. And today it was again photo finish. I wish you had given me more time to prepare. But then I said, okay, it's my duty. So yun po, more of the networking and finding out the different experts and getting their views. Inviting a different set of fans. The Department of Health has put together a speakers bureau. So you might want to tap into the Speakers Bureau because all of us will have received media training and also have learned how to communicate with the different groups.
Okay.
So that's one. And also you can simplify things. Sometimes the discussions you have are very
highfalutin,
technical, complex. If you notice in our conversation tonight, nagtatagalog po ako. Kasama po yan sa akin pong papel bilang isang mananaliksik at siyentista na kailangan makapag-communicate po. So, challenge din po yon, how to communicate across. But my plea is not to just depend on social media, as we tend to do, because there's still many people who listen to the radio, who don't have access to the internet, who still depend on the face-to-face interaction. So if you can help us disseminate the correct messages, we are grateful for that assistance and that collaboration.
How do we handle, what would your advice be to us? Because it's a real dilemma. How do we handle, on the one hand, a politician or a political leader that spouts something grievously wrong? Now, on the one hand ba, sabihin ng isang political leader, sabihin natin si President Duterte, in one real example, he says, punta lang kayo sa gasolinan, magugas kayo ng kamay ng gasolina kung wala kayong access. On the one hand, we report that because for us, it's a matter of accountability as well. We want that on record and so on. On the other hand, we are conscious, even when we say, hindi po totoo yan, walang basis yan, we also amplify the wrong information. So how should we handle it when the news moment is there Now, on the one hand, there is political accountability to put on record. On the other hand, we're wary, might we be just amplifying the wrong information?
I don't really know how you package your news messages in TV5, but I guess you could probably say it's been reported that an official said this. However, we'd like to caution everybody about following the said practice, which was said by this particular official. Si Trump po, noong nagsabi niyang pwede kang uminom ng Clorox, ang dami pong dinala sa emergency rooms all across the US. And nakiusap po ang different health departments of the different states, including the Centers for Disease Control. Please, please, hindi po yan totoo. No, so, palagi ko, newsworthy pa rin siyang sabihin to teach people a lesson. Baka yung pag-package nyo, no? Napabalita po na sinabi po ni ex-person ito, kaya lang po, ingat po tayo kasi po hindi po magandang pamamaraan po yon para sa pangangalaga sa ating sarili.
Okay. Okay. Professor Nina Castillo-Carandang, maraming salamat po.
Salamat po, Prof.
Okay. And thank you again for joining us. That's it for this special edition of the Chiefs. But we hope what was discussed here will keep the conversation going. I'm Robbie Alampay.
I'm Mami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5, and we are One News.